The Go Baby Go program at Oregon State University involves modifying off-the-shelf ride-on toy cars to have greater accessibility for young children with disabilities to use for mobility and play. Here at Oregon State University, the two main aspects of the Go Baby Go program include undergraduate education through teaching, as well as conducting research to understand the effect of modified ride-on cars on young children with disabilities, mobility, and development. The two kinds of modifications we do is the first, adding a really easy to press and large activation switch on the steering wheel. These cars typically come with foot pedals for activation, which can be really difficult for children with disabilities to use. And then second, we use low cost and readily available materials to build up individualized and custom seating support systems to make sure the kids are safe while using the car. Some of the most documented benefits include mobility itself, as well as participating in daily life in the community, as well as social skills and language development as well. Students can get involved through enrolling in an honors college course that I teach here on campus, which involves lecture and discussion about the science behind Go Baby Go. It also includes a lab experience where students actually modify ride-on cars as a part of their course experience. Students can also get involved with participating as a research assistant in the lab. And so getting lots of different kinds of experiences related to research, everything from data entry to reading literature, but also working directly with families and children. Some of the benefits for the students that are involved in the program is that they get real-world experience with modifying ride-on cars. And so there's a lot of problem solving that comes along with gaining that experience. And then through the research experience, students really learn a deep dive into a very specific topic. And a lot of the students are interested in careers in physical therapy, occupational therapy, or other allied health professions. And so this can really give them an opportunity to learn a lot of information about a specific topic with the hopes that they apply it to their future careers.
I didn't know much about the problems that children with disabilities faced when it came to mobility. I didn't realize that there was an age limit on wheelchairs. And I think it's really cool that this lab allows kids to be able to move on their own at an early age. Take the honors colloquiums, toy-based tech for children with disabilities. That was a really cool class, and it's a good way to get introduced to both the subject and the professor who's running the lab.
So the Go Baby Go program has really grown in Oregon. We've partnered with OHSU to expand the community program and really serve as the hub, since they serve a lot of families and children directly through the services that they offer. And so primarily here at Oregon State University, we've really transitioned to focusing primarily on undergraduate education and research. Our goal is to become obsolete in terms of the Go Baby Go program. And what I mean by that is we hope that eventually there's a toy that's designed with the same features that we're modifying through the Go Baby Go program, so that every family can buy off the shelf for low cost exactly what they're looking for. For me, adapted physical activity and education really stems from that idea of trying to provide equitable mobility experiences to all children. Every time that I ever see a kiddo with a disability who gets access to mobility for their first time through a modified ride-on car, it's always different, it's always fun, and it's that moment across many different kids that I would say is the one experience that sticks out to me every time I think about the program.